Another beautiful Saturday morning here in the capital, Accra. You're welcome to Living Well. My name is Ethel Popolampo, and the show is called Living Well. We are live on DSTV channel 277 and also on Facebook at Metro TV Ghana and also on Twitter at Metro TV GH. So do well to stay tuned no matter where you are. It's still the Breast Cancer Awareness Month, and we are still in the business of throwing more light on this condition. So when we come back from the break, I'll introduce you to my guest, and then the discussion continues. Right, just as the information on the screen showed, don't wait to see symptoms, because I understand that the moment you begin to see symptoms, you are far advanced. So get screened, and then health professionals can help you from there. Earlier, I told you I have a guest. Today, we are only two here, we are not three. So I have a guest who will help us get to know why it's important for you to get screened and not wait to see symptoms, why early detection is important. Let's take his profile. When we come back, we get to meet him.
Profile of Dr. Emmanuel Jima Amankwa. Dr. Emmanuel Jima Amankwa is the CEO and specialist surgeon at Ridge Medical Center, a compassionate and focused caregiver with extensive experience in his field. He is a member of the Ghana College of Surgeons and West African College of Surgeons. Dr. Amankwa has many accolades, including CEO of the Year at the Ghana West African Healthcare Excellence Awards 2022 and the winner for the 40 Under 40 Awards 2023. He has collaborated with many companies to organize outreaches and screening for health conditions of public health importance, including breast cancer. Dr. Emmanuel Jima Amankwa consistently displays values of humanitarianism, honesty, and public service.
I know I promised after the profile you get to meet him, but before you meet him, let's take the Vox Pop.
Know that this month is Breast Awareness Month. My knowledge on it, I think I've heard a couple of times, people losing breast, and I just found out this afternoon that some people die from it, but I didn't know about it. And I do test in the house once a while, not that often. I don't really go to the hospital. Nobody checks them, check the right, press it and see if there are any lumps. And I think when you find something, we are advised to go to the hospital to check and then know the next step. So I advise young ladies to try and check it. It's a really deadly disease, and knowing a lot about it will help save a life.
The month of October is usually for the awareness of breast cancer. Breast cancer is a form of cancer that affects the breast, but we have the assumption that it only affects females. But I'm here to tell you, guys should also go and test for breast cancer, because breast cancer is really deadly, and then we have a lot of our mothers, even our youth, dying from breast cancer. And one way to check for breast cancer is regular massaging of your breast to check out for lumps. And then there's a procedure for that, which would be shared if you search on the internet for it.
It's when a lump is in your breast, because my sister once had a lump in her breast and she went for surgery. And that's what I know about breast cancer. That is when a lump comes into your breast, it makes the breast bigger. Yeah, that's what I know. And to the government, what I can tell the government is that they should educate the girl child on the effects of breast cancer, the causes, what they are supposed to take, what they're not supposed to take, like in their diet to prevent it.
So if feel say lamp bioma, immediately now I have to go to the hospital for a checkup. No one who say if the lamp no, maybe I cause it that breast cancer and I say whatever no. Say if they find out after their investigations, let's more find out to say lamp no, they have to. It's the earlier detection no, it prevented the breast cancer.
Mpacho sa breast cancer na ayeba no ye nim adokoro so no se de aba bebre ekuma ye twetwa amanfo no fuo ni ma no fuo nkala nkete mpacho ye pese aban wombo ye na sa yare no entwo so kakra na se de ya do so ga na dodo.
Right, those were some Ghanaians, females, telling us what they know about breast cancer. Doc, welcome.
Thank you very much.
After watching that, how will you rate the knowledge of the public?
I think the knowledge of the public from that small group, they seems to have an idea. But the last person who spoke, you can see there's still a gap in the knowledge of breast cancer. And this is something that happens to the everyday Ghanaian. Okay, so there's a major gap in knowledge, which we are trying to breach with this awareness that we do.
When I posted on my WhatsApp status some time ago that, oh, it's October, Breast Cancer Awareness Month, I was like, someone said, why should the whole of October be dedicated to breast cancer? Interestingly, I got another person say, why should it only be October? Why shouldn't we talk about this all the time? What do you get in your field of work? Do you get people wanting to know more, or do you get people feeling like, we've heard a lot, can we move on now?
Yes, so I think people haven't heard a lot. Okay, and the aim of having a dedicated month is to amplify and enhance the awareness. All year round, we still have advocacy. However, we want to intensify it. That's why we choose a month to have that. And this also is in line with World Health Organization's calendar, okay? Because with the October month, we are going to so many districts, so many facilities, and we are campaigning strong. Because breast cancer is a public health, it's a global public health problem. And it doesn't only affect low-income countries. It cuts across to even high-income countries. As at 2020, the WHO had statistics as much as 2.3 million women were diagnosed of breast cancer, and is the 5th leading cause of cancer-related death worldwide. And we are not left out. In Ghana, currently, according to our country profile, female breast cancer is the commonest cancer. Okay, incidence of about 20.4. So there's still a lot of room for advocacy, okay, because there's a burden. The disease burden doesn't just affect the woman, it affects the family, it affects the community. So it's something that, even though we can do it all year round, we want to intensify it in the month of October.
Right, right. If you just joined us, you're watching Living Well, and we are still in the Breast Cancer Awareness Month. You can join the discussion by sending your text to 055-009-0647. I'll take it again. WhatsApp text. Please don't call the number 055-009-0647. So I'll be expecting your text and your questions to Doc so that we all share ideas and get to know more about this condition. Doc, this awareness has been going on for some time. Do you get people just walking in to test, or they come when they feel like there's an issue? Because we always say that get screened. How is it like? Do you get people coming in just to test because I need to do it?
No, so unfortunately, that is the point we want to reach. Okay. However, we are not there yet. Most people come in when they notice there's something in the breast. That is when they come in, any of the symptoms. In more advanced countries, they have routine checks in which some companies mandatorily make sure that their staff and their clients go for the checks. That is in other countries. In Ghana, it's rare. The education is getting there. So people are coming in, but it's not as much as I'm just coming to screen. It's rather I have a lamp. That is why I'm coming. So we still have a lot to do so that people, it becomes a part of life that I routinely check my breast. Because other statistics show that as a woman, you are, in your lifetime, about 12.2% of women who get breast cancer. At a certain
cover
point.
myself with the blood of Jesus.
Yeah, so I mean, that is the reason.
That's a huge number.
That is a huge number. That is a huge number. And it's something that you realize that we haven't gotten to the point of preventive health care, where in our mind, we know we have to be checking. Yeah, so we are still working, hoping that one day, the average Ghanaian, despite your social strata, I just want to come to the hospital to check. Yes.
What do you think will be the reason why people just don't walk in to check? Because you are in the space of advocacy to being a medical doctor and being as a part of advocacy for breast cancer. What have you identified as being the reason why people just don't walk in to check?
Okay, so I'll put them under two umbrellas. The myths and fear.
Okay.
So the fear comes a lot. I mean, I have a friend, which you say, oh, I've mentioned it on TV, who is outside Ghana, called me and started talking about some breast issues. And she wants to go and check, but she's afraid. So the fear of knowing that you have a disease, that is one thing that drives people away. Then we come to the myths. There are a lot of myths that people rely on. One, some say breast cancer only occurs in women with big breasts. That is some of the myths over there.
Oh, really?
A woman will say, oh, my breast is very small. How can I get breast cancer?
Okay.
But breast cancer cuts across. Once you have a breast, and it even occurs in men, because men too have breasts. It's only that the percentage is about 1%. It's very rare. So that is one myth. Another myth is that if you wear push-up bras, you can get breast cancer. That is a myth which it's not true. Another myth is, this is what makes me unpopular when I talk about the men, that a man sucking a woman's breast will prevent breast cancer.
Right. Last week, we had a whole debate about it.
Yes.
It's a myth.
It's a myth. The fact is that a breastfeeding mother, breastfeeding the baby, actually has a protective effect and prevents them from getting breast cancer. Another myth is breast cancer is a death sentence. And that is what makes people so afraid.
It's interesting you are saying breast cancer is a death sentence, because a lot of people don't even know that you can lose your life from breast cancer. They just think with breast cancer you are losing your breast, which I think is also a myth to some extent.
Yeah.
Because when you come in early, we check, and treatment commences early, there's a good probability that you might not lose your breast. So it's neither here nor there. Continue, say.
Yes, yes. So I mean, those are just the general ones that are there, which we always try to debunk. So those are the few. I know there are even more, but these are a number of them that we get. And one of the popular ones you hear that it's a case. So because it's a case, before the person will come to the hospital, would have gone to so many different places. And most of our women in Ghana, the breast cancer presentation at the hospital, about 70% of it is advanced, what you call a higher stage, stage 3 and above. So these are some of the myths that is making it a bit difficult for people to come in to see us.
Apart from myths, don't you think society also plays a little role in women not coming forward to get tested or screened? Because it's strange for a Ghanaian woman to just go expose herself to a stranger. Don't you think society plays a little role in that?
Yes.
And maybe finances too.
Yes, so Yes, one is, as you said, so we have a cultural inhibition. And the cultural inhibition is, okay, a woman feels shy even, showing the breast for, they feel it's an area, an intimate place, which shouldn't be exposed. So culturally, it also suppresses us from seeking that, okay? So you asked me something else.
Finances.
Finances. For finances too, yes. It's also a major issue because for those who are aware of maybe some of their relatives being treated for breast cancer and knowing what they had to go through, some are even afraid to come for it because they are like, even if I come and I'm tested and I'm positive for breast cancer, what do I do next? So it's an intricate, it's a very complex, we have a complex social, religious, cultural, it's all interposed in women actually coming in to see us for the checks. It's quite complex.
You mentioned treatment when it comes to breast cancer as the financial bit.
Yeah.
Is there a cost attached to walking in to get screened?
Yes, so if you are coming into the hospital, okay, generally when you are coming, I'm coming to see the doctor. So there's definitely, based on where you are going to, some people have insurances, either national health or private insurances. You go, you see your doctor for the, so that is covered, okay. However, for those who, when it comes to treatment, some insurances cover, others too don't cover. And based on availability of drugs, there might also be some increased costs. And let's say even the procedures that are done for you, okay. Now we don't just do what you're saying that you lose your breast. Now we also have reconstructive breast surgeries.
Okay.
So that also has its own cost implications.
Right. Say early detection. What do you consider early detection? Because last week we started a conversation around breast cancer, and one thing the doctor said was, by the time you start seeing these signs, you might be at the advanced stage. So what is early detection? Because even though there might be a lump in your breast, it might not just be the earliest stage of it. You might be noticing it at a later time because you've not been checking. So what then is early detection? What is considered as early detection when it comes to breast cancer?
So early detection is getting screened and us finding one, you mentioned a lump. A lump based on the size and based on whether if it's within the breast or outside the breast can constitute early detection.
I don't understand. Take that again.
So when you have a lump in your breast.
For those who don't know what a lump is, it's just...
Yeah, so it's like you feel like a swelling within your breast. Probably you can, maybe a marble sort of, or a small pebble sort of. That is the lump in your breast. So
is it supposed to be hard or soft?
It's based on the stage.
Okay.
But usually, if it is breast cancer, it's usually quite hard. But not all lumps are cancer. That is the first thing. So you come in and getting screened, and after screening, we are sure the disease, that is the breast cancer, is just confined within the breast. Then we are looking at more of an early detection.
Okay.
And the probability of cure is high. Okay, because we have, in most advanced countries, survival rates after treatment is as high as 90%. You can stay for as long as 5 years. Okay. So
wait, treatment, after treatment, you can stay as long as
5 years. That's what you call survival.
So even after treatment, there's a possibility you might lose your life?
So when we talk about treatment, there are 3 things we look at, okay? You look at the patient, you look at the stage of the disease, and you look at the kind of breast cancer.
Okay.
So after treatment, based on your stage, So assuming you came in an advanced stage, stage 4, or that's a very advanced, that is almost like palliative care. Palliative care is us giving you comfort, but there's really nothing we can do to save your life. However, from the stage 2 and stage 3, for that we have to continuously monitor and follow you.
Okay.
Yes, your survival is lower if you have an advanced disease. Your survival is higher if you have a much more early disease.
Okay.
So we want to get it early so that your survival rate is high.
Right.
Yes.
You can continue. So you were telling us if the lump is found in or...
Yes, so if the lump is found within the breast, we'll assess to see if it has spread. That's if the cancer has spread. Okay, so we'll examine you, we'll do mammography for you, we'll do ultrasound for you, and what we call staging. After we confirm it's breast cancer, we take a tissue out of your breast and confirm it's breast cancer. Then we stage it. In staging, we want to know how far it's gone. Has it gone into your chest? Has it gone into your abdomen? Has it gone into your bones? And there are a lot of investigative modalities that we do for that.
Right. You've just brought us right where we have to be, that is treatment. Are there types of treatment for breast cancer? Because you've mentioned that the stage at which you are will determine what you get. At level 4, stage 4, you just get palliative care.
Yeah.
So what do we need, what kind of treatment is done at what stage?
So first, to talk about treatment, is there's what we call a multidisciplinary approach. Not one specialty deals with breast cancer. So before we have a breast cancer treatment, we have a tumor board, and it's made up of a surgeon, oncologist, radiation therapist, psychologist, and you, the patient, involved.
Okay.
You discuss the patient. We know how far your disease has spread, okay, and the type of disease that you have. The various modalities are, we have surgery. Okay, I think I'll just mention them, then we can now break them down. We have surgery, we have radiation therapy, we have the medications. Under medications, we have chemotherapy, we have hormonal therapy. Okay, we have targeted therapy. So for surgery, we have a lot of types of surgery.
Before we go, you mentioned ultrasound. So ultrasound is at the diagnosis?
Yes, so ultrasound and mammography. So ultrasound, usually for women who are below the age of 40 or 35, we do the ultrasound to scan for that.
Okay.
Okay. However, if your age is above 40, then that is when we do the mammography. Okay. Because we don't do mammography for younger ages because the breast is very dense and you might not be able to pick out these lesions if there's even any.
Okay. So now back to the treatment, surgery first. You wanted to start with surgery.
The surgery, yes. So with the surgery, as I said, there are so many types of surgeries that can be done. We have what you call the breast conservative surgery. As you said, it's not all of the cancers that we rush to say we are taking out your whole breast.
Okay.
We have a criteria to say we are conserving the breast and we are taking just part of the breast out. But after that is done, you undergo other therapies, that is radiation therapy. And if the breast tissue is responsive, has what we call receptors, that is the estrogen and progesterone receptors, we put you on some form of hormonal therapy for a period. So that is one aspect. Another surgery is what we call the modified radical mastectomy, in which we take out the whole breast. Okay, we take out the whole breast. Then you also do either the radiation, with or without, plus the chemotherapy or hormonal therapy. Another aspect which now of surgery is being there, which advanced countries do, is the reconstructive surgery. So now there's hope. Even if we take out the breast, we can reconstruct a new breast for you.
That was what I was about to ask, because in this world of advanced technology, plastic surgery, even if I lose my breast, there should be a way out of maybe fat transfer or silicone or something. It's
Yeah.
good you mentioned it.
Yeah.
So ladies, please get screened. There's nothing to be scared of.
Yes, and with the surgeries, we can use your own tissue actually to reconstruct and mold it for you. Or as you mentioned one silicone, we can put in prosthesis, okay? So once you lose the breast, there's still hope because we can construct a new one for you. So, I mean, that is the aspect of surgery. Radiation therapy, what I mentioned, for radiation therapy, after the breast conservative surgery, we do that for you to prevent local recurrence, okay? Then we now have the medication, the chemotherapy, hormonal therapy, based on whether or not the type of breast cancer you have has what we call the estrogen or progesterone receptors or HER2 receptors. So, I mean, those are the various modalities that we have for treatment. For palliative care too, it spans across that. But palliative care, as I said, that is where we are trying to avoid going. Okay, we want to avoid palliative. Our aim is for cure.
Yeah, yeah. So I have a question here that I would like to ask you. This is coming from Nana from Pokwase. She or he says, breast cancer has killed my auntie and some of my female friends. Isn't there a cure, and why does the chemotherapy make them look so old? I think the cure part bit you've tackled.
Yeah.
And she's also asking, where is your hospital located? I think Ridge Medical Center is
Yes, at the SU Tower.
Yeah,
yes,
at Ridge. So she wants to know, why does chemotherapy make them look so old?
Yes, so chemotherapy is a medication that destroys the cancer cells. However, it doesn't only destroy the cancer cells. Even though the main target is the cancer cells, it also destroys and kills some of the normal cells. However, that rate is slow as compared to the cancer cells. So before we take you through chemotherapy, we actually counsel you on the kind of changes to expect. Your skin wrinkling up, you are going to lose your hair, you look a bit old, but it is for the period of treatment. After the treatment, if you see some cancer survivors, you wouldn't believe that that was them. So the fear is there. I might look old, I might not look as good as I used to, but after that is done, and I mean, you are eating well, you are living healthy, you return back to your former self.
There's been a lot of research done when it comes to breast cancer.
Yeah.
So what's new in the world of treatment for breast cancer? You've mentioned the reconstructive surgery, which is good news. It is good news.
Yes.
Apart from that, what is new?
Yes, I mean, for now, that is one of the advancements in breast cancer treatment. And our aim has always been for cure. We've modified so many types of surgeries. First, the surgery for breast cancer, we took out a lot of tissues, including muscles and the rest, but currently we don't do that. What we do is we take out just the breast, and we have what you call, when the cancer is spreading from the breast, it runs through what you call lymphatic vessels and blood vessels.
Okay.
So if it's spread towards your lymphatic vessels, which is usually in the armpits, okay, just to also mention, part of the breast goes towards the armpit, what we call the axillary tail. So some women will come, oh, I had a boil, and I was treating the boil, and the boil was never getting well. They come and we check, and it's breast cancer. So the breast cancer itself can move towards lymph nodes in the armpit, or what we call the tail of the breast itself can also have the breast cancer.
It makes a lot of sense, because last week we had a nurse on who was telling us how to, we'll get you a video of how to self-exam, but she said you have to start from your armpit. So it makes a lot of sense why she kept saying you have to start from your armpit.
Yes.
Last week also we mentioned some of the risk factors. Hereditary was one of them. lifestyle.
Yeah.
So since you get to meet a lot of patients, what do you think is one of the major contributing factors when it comes to breast cancer in Ghana?
That has always been the quagmire. We haven't been able to identify it because most of my patients personally come and most of the risk factors, they don't have it. However, we understand it because statistically, actually half of women who present to us for breast cancer, the only risk factors that they have is female gender and advanced age, above 40. So it's actually difficult to pinpoint. And I mean, other risk factors like the family history. This lady who sent the text, which I think she says the auntie, so she's at 2 to 3 times increased risk of getting breast cancer. So I'd advise her, either she comes to see us at Ridge Medical Center or she gets a hospital to be regularly screening herself because she's 2 to 3 times more likely to get breast cancer. Some come and they have other risk factors, so the family history, and with the family history, it's not just about even women. If your sister, your auntie, or your mom has even ovarian cancer or breast cancer, that one, you're at increased risk of it. If your uncle, your brother, or your father had prostate cancer, you're also at increased risk of breast cancer.
At this point, I'll just say there's no way to escape this. You just have to get screened, see a medical professional, and know what's going on in your body. You are still watching Living Well with me, Ethel Poplampo. Today, we are discussing breast cancer, the importance of early detection and treatment. Let's take a break. When we come back, the conversation continues. All right, welcome back. We are still discussing breast cancer, the importance of early detection and treatment. If you are just joining us, you are welcome. You've not missed much. The conversation will still continue, but you can join the discussion by sending in your text on 055 00 90647. 055 00 90647. Before we continue the conversation, let's take this story. When we come back, we'll continue.
Breast cancer is the most important invasive cancer in women and the main second cause of cancer death in women after lung cancer. In Ghana, where over 4,000 women are diagnosed with breast cancer annually, almost half of them will die. A study in 2022 showed that women in Ghana are diagnosed at more advanced stages of the disease. Up to 70% of women have advanced stage cancer by the time it is identified. Here are some key points about breast cancer in this report. The first symptoms of breast cancer are usually an area of thickened tissue in the breast or a lump in the breast or in the armpits. Pitting or redness of the skin of the breast, like the skin of an orange. A rash around or on one of the nipples. A discharge from a nipple, possibly containing blood. A sunken or inverted nipple. A change in the size or shape of the breast. Paling, flaking, or scaling of the skin on the breast or nipple. After puberty, a woman's breast consists of fats, connective tissue, and thousands of lobules, tissue glands that produce milk for breastfeeding. Tiny tubes or ducts carry the milk towards the nipple,
Breast cancer usually starts in the inner lining of the milk ducts that supply them with milk. From there, it can spread to another part of the body. The risk increases with age. At 20 years, the chance of developing breast cancer in the next decade is 0.6%. By the age of 70 years, this figure goes up to 3.84%. Being exposed to estrogen for a longer period appears to increase the risk of breast cancer. Breastfeeding, especially for over 1 year, appears to reduce the chance of developing breast cancer, possibly because pregnancy followed by breastfeeding reduces exposure to estrogen. Women with cosmetic breast implants who are diagnosed with breast cancer have a higher risk of dying from the disease and a 25% higher chance of being diagnosed at a later stage compared with women without implants. This could be due to the implants masking cancer during screening or because the implants bring about changes in breast tissues. What are the treatment of breast cancer? Treatment of breast cancer depends on the type of breast cancer, the stage of the cancer, sensitivity to hormones, the patient's age, overall health, and preferences. Remember, there is no sure way to prevent breast cancer, but some lifestyle decisions can significantly reduce the risk of breast and other types of cancer.
Right, there you have it. That was a story on breast cancer done here at Metro TV for the news. Doc, let me come back to you. You mentioned mammogram, biopics. You mentioned a lot of English words. But then I think mammogram and biopics are what we hear more often. What is the difference?
So we have a mammogram and we have the ultrasound. So with the ultrasound, that uses sonic waves to examine the breast.
Okay.
It penetrates through the breast tissues to find out where there are lesions, what we call the breast cancer lesions. Those can be detected using the ultrasound. And as I said, usually women who are below the age of 40, around 35, we recommend them to do that one. Mammogram is a form of X-ray, a very low dose X-ray examination, test. And for that one too, we usually recommend it for women who are above the age of 40. And the rays are blown through the breast, and areas that there are lesions, there are lumps and there are problems in there, the pathologists are able to come out from the mammography report.
And the biopics?
Yes, and the biopsies.
Biopsies.
The biopsies. For the breast biopsies, after we have checked to see that you have this lesion in your breast from the mammo, we will now use a needle to what we call a true cut biopsy. That's the ones that we usually do. Then we take out part of the tissue, the core of the lump. Then we'll take it to the pathologist who would examine it. After examining, then they tell us whether it is a breast cancer or not. So that is the biopsy, which is done. That is the latter part. It's part of the diagnosis. So once we know that, okay, now we are diagnosed of breast cancer, then the next step is going for treatment.
Right. You kept mentioning age. Does that make age a risk factor too?
Yes. So age is actually one of the risk factors. And as I said, in most studies, half of people of the population who have breast cancer, there are only two risk factors: gender, being a female, and having breast, and also the age, which is usually above the age of 40. However, in current times, we are noticing that women below the age of 40, within their 30s, are presenting with breast cancer. And some of them have strong genetic lineages. So if maybe as we're talking about, your auntie, your mother had breast cancer, your risk of getting breast cancer is quite high and at a much younger age. So I'm sure we are all aware of this popular actress, Angelina Jolie.
Yeah.
Some years back, she had to do what you call a bilateral prophylactic mastectomy, in which she took out both breasts and they reconstructed it for her because her mom died at age 56 of ovarian cancer. And they tested her for, there's a gene we call the BRCA genes.
Okay.
The BRCA genes, if you test and you are positive, you are 60% more likely to get breast cancer than the general population. So her risk was really high and she wanted to avoid it. So they had to take out both breasts and the plastic surgeons reconstructed it for her.
Right. At every point, it gets scarier and scarier.
Yeah.
But let's treatment. You mentioned surgery and all the others that you mentioned, how it is done. At the point where we present breast cancer at the hospital, you mentioned most people come in with, I feel a lump, not I'm just here to screen.
Right.
At the point where we present breast cancer, what treatment do you usually give? Is it usually surgery, or do we usually present it at an advanced stage, and is there specific treatment given, or mostly in Ghana, is there specific treatment that we see?
Yes, so the first thing is that most of our clients who come, almost more than 70% of them, always come in at advanced stage. And those who come early, as I said, before we even decide on how we are going to treat you, we consider the patient, we consider the kind of cancer, and we consider how advanced the cancer is. So once you come in with that, then we discuss at our tumor board, which has the various specialists. Then we decide that, okay, this patient will benefit from surgery, radiation therapy, or chemotherapy. So management of breast cancer is tailored. It's tailored to every patient. So that's why we tell people that, yes, it's not like it's a basket, a net for everyone. That's why we tell them that if you come, it doesn't necessarily mean that we take off your breast. You know, some we can do breast conservation surgery, in which we will save part of the breast too for you. So it is individualized treatment. That's what we do for breast cancer.
Right. Let's talk about, there's been diagnosis, there's been treatment. During treatment and after treatment, what is required of the patient?
So if you've had breast cancer in one breast, there's a higher chance of you getting breast cancer in the other breast. So most people who are diagnosed with breast cancer, they're on a long-term, what you call follow-up.
Okay.
Some close to 5 years to 10 years. There are these medications that we call hormone medications. One of them is tamoxifen. And for people who have the receptors, what we call estrogen or progesterone, they are kept on it for a long term, as long as even 5 years. So there's a constant follow-up. The first year, we can schedule you for either every 3 months, every 6 months, the following year, every year. And we are examining you. We are scanning your other breast. We are doing the mammogram for your other breast. So when we are done with you with the treatment, we have to, it's a long-term follow-up. So at least for the next 5 to 10 years, you have to be in constant contact with your healthcare provider. One, to make sure that you don't have recurrence at where we've treated, and two, to make sure you don't develop a new cancer in the other breast.
Is that what is called the remission?
So
I hear it's during cancer treatment.
Treatment, yes. So remission is, I mean, the cancer has resolved, so you're in remission. Yes. Recurrence is when it comes again. Okay.
Now that we know what the patient is supposed to do, in terms of support, what do we as family members, the society, do to support patients that are going through treatment?
Yes. So it's a very, very important question you've asked. So breast cancer aside it being an individual person's disease, it's a social disease. We require a lot. That's why, as part of even the team that manages it, we have the clinical psychologists. Some even involve religious leaders. So this is the point that we usually appeal with religious leaders, to be talking to their people, to be checking, and even though they are doing their prayers and others, we are also treating them alongside. So we need them on board for spiritual support. The psychologist is there for psychological support for the woman. The family, we involve the family, so that the family is there to support, because they'll be living with the woman who has the breast cancer. And it can be so disheartening to see maybe your wife going through chemotherapy and looking so old, and so it takes a lot. Just the woman being there for the treatment alone is not the best. What we say is that we need the society to be involved. We need family to be involved, encouraging her, providing financial support and all of that. So it's a very, very important aspect.
And is that the case? Is that the reality?
Unfortunately, for clients that I see, some in the districts, it's not a reality. There are a lot of financial challenges, and as we said, the culture and the myth, it's also something that is preventing people from coming forward. So if you choose to come to the hospital to be tested for it, for them, they'll tell you that we didn't tell you to come to the hospital. We told you to resort to this and this, but you came to the hospital. So some of the women are actually neglected by family. That is usually the sad aspect. So they give up hope, they go and stay home, and within a few months or a year, then they are passed away.
Right. I just read a message from one of our viewers, and I'm quite sad. She didn't add her name or where she's testing from. She said, "My sister has been detected or diagnosed of having advanced stage of breast cancer, and the doctor have said they cannot take off the breast, but she's still on chemo treatment. What is her survival rate? Because she's currently complaining of blurred vision." Is that palliative?
Yes, so where she is now, if she's complaining of blurred vision, that means probably the cancer has advanced into the brain. At that point, it's palliation, unfortunately. Unfortunately, at that point, it's palliation. That's why we always want to get it very early, when it is within the breast, or what you call even locally advanced, that is within the region of the breast. Cure rates and survival rates are higher. But once it gets to the brain, it gets to the bones, it gets into your abdomen, your liver, other organs, unfortunately, that is too advanced. So what she'll be taking now is just to try to improve her quality of life. We manage the pain, we manage the vomiting, you manage this blurred vision. So, and this is where we are trying to avoid getting to. We want to get it early. So for her, I would advise her that now that she has seen that the sister is going through this, with that genetic link, she has to be very vigilant on herself, so that if she happens to get it, we can treat it earlier so that it doesn't advance.
And I think this is when the support comes in.
Yeah.
I know. Okay. Now back to the questions. What is the research, or what is new for breast cancer advocacy treatment in Ghana, apart from October, where even though you say after October there is a lot of advocacy that goes on, we don't hear about it.
Yeah.
So how do we, because this is very serious.
Yeah.
People are living with it without knowing that they are living with it.
Yeah.
People are living with it and don't know that I might lose my life if I don't go to see the doctor. We live in a society where religion is everything. So how do we make sure that everybody knows about this? Medical professionals are doing their bit, but then I feel like more has to be done. is there a gap that has been identified being the reason why people are not getting to know more about this? And if a gap has been identified, how are you guys trying to bridge that gap?
Yes. So you are right. So we have the socio-cultural gap, which is one of our main issues. And as you mentioned, we have the religious bit too. So for now, most strategies like what my hospital also does is that we try to involve those who have a lot of contact with people around, people who are seen in high esteem, you know, in their community, such as pastors, leaders in the community, assemblymen, and all those things. If they are involved, even after the awareness month, they stay with people in the community.
Yeah.
So if you come to me that I have a lump in my breast or something, me who has been educated as a leader in the community, what will I do? I'll say, okay, quickly go to the hospital and come back and let's discuss the way forward. So we do our enhanced advocacy. For us at Ridge Medical Center, we will even do it for the month of October and November. That's what we are doing. But at the end of the day, when all the pink balloons are gone, it is the community leaders, it is the families, it is the religious leaders. They are the ones who have to hold the fort for us. And it has to be at that point where they accept that responsibility that, no, this is not a disease to play with. It's a disease that, causes mortality, it causes social distress, you know. You see how some of your viewers are sending in messages. So it's really about health facilities. We can do as much as we can, but it now comes down to the same way probably when they know they have malaria, they quickly rush to the hospital, sort of. They should see breast cancer in that same light. And the cultural acceptance that even a woman can come and can be examined, her breast can be examined, should be culturally acceptable. Once, and this can be done through as I said, the leaders, the chiefs, the assembly people, people who live in the community. If we can breach this gap, then I think we would actually advance in this fight.
Right. Yeah. I'm just getting to understand that breast cancer, it's a preventable death. If you come in early, you get screened and treatment starts early. You're still watching Living Well. Let's take the aerobic segment. We'll be right back.
Good morning and welcome to Alisa Hotel Gym. My name is Richard Labi and I'm your instructor for today. We're going to do 3 different workouts today. That is the first machine we're going to use, and it's the leg press machine. Okay, so this is our leg press machine. It's purposely for the thigh. So today we're going to do our thigh workout with my guest here. Your name is? Treble. Okay. So if you're going to use this machine, it's not complicated, it's something simple. So you just put your leg here, your 2 legs, of course, here. And then you push it. Yeah. When pushing, don't lock your knee. Just push and leave some space behind, and then you go back. That's it. So our trainee is doing 15 reps for us so that we'll see how it goes. 6, 7, 8, 9, 10, 5 more. 1, 2, 3, 4, and 5. Good. Another 10 reps. So keep going, keep going. No pain, no gain. In bodybuilding, you need to push hard. So let's do it, boy. Okay, in our leg press exercising, our weight is closer to the hand. So when you are pushing, you make sure you don't put your hand under the weight. You may have another accident there. And also, as I told you earlier on, when you are pushing, don't lock the knee. You may have bad effect on the knee. Okay, we are wrapping up on our leg press machine today. As I said earlier on, when you are working out, you watch your hand for the weight, your leg, don't lock the knee. We are done for our leg press machine today. My name is Richard Labi, then this is Alisa Hotojim. Thank you.
Right, welcome back. Doc, before we move on to our next segment, during our cancer talks, which we've done extensively in the past 2 months, I do understand that cancer patients can't be involved in vigorous exercise, but then maybe climbing a flight of stairs, staying active is enough. Can breast cancer patients go to the gym and stay fit? And if they can, what does it do for their health?
Okay, so as part of the prevention of breast cancer, we actually, because obesity is a risk factor, we advise people to be fit, exercising, try and lose weight, eat healthy. Okay, that is to prevent the breast cancer. However, if the breast cancer is advanced, especially when it gets into the bones, for that is where the danger comes, in which any small fall or any vigorous activity can even lead to the bone breaking.
Okay.
Yes, so that is when the cancer has spread into the bone. So usually at that point when it's an advanced cancer, it's not something that we really recommend, because any vigorous activities can actually even lead to, any small fall can actually lead to the bones breaking.
Yeah.
So after you've undergone your chemotherapy and you are in remission, and for that part, then we advise you start with a healthy lifestyle, eating well, exercising more. But that is when we get to that part.
Right. It's good you mentioned eating well, because the next segment is, everybody who watches this show knows that when it's time for this segment, I'm always smiling and happy. Let's take the foodies joint. We'll be right back.
Welcome back to another episode of Living Well here on Metro TV. My name is Darryl Freeman. I am the executive chef of Alisa Hotels Northridge here in Accra. So last week we made a salad. Were you making it? I need to double check and watch. So this time we're going to make some smoothies, so let's get smoothing. So what we're going to do, we're going to make a tropical smoothie. So the ingredients we've got today is banana, passion fruit, natural Greek yogurt, and also some natural honey. Okay, so with the banana is very good. It fills you up for longer, so you don't end up eating a lot during the day. So you have a couple of bananas, it will actually fill your stomach up, so you don't have to eat and eat and eat and eat. Also, it's very good for your blood sugar levels, so a very good fruit. So then we've got the passion fruit, other known as grenadilla. Now this fruit does wonders, especially if you're a lady, because this has a lot of collagen inside. And you know the ladies like to keep their skin nice and clean and fresh and looking younger. So I recommend using some passion fruit or eating passion fruit. We've got some Greek yogurt here. Okay, Greek yogurt, you make sure it's unflavored and that. So we don't want any natural sugars or going in there or any other sugars or flavors. We want to have it natural. Okay, so this is a good source of protein. And then also what we've got is we've got some honey here. Okay, so this is a natural sweetener. We're not adding any sugar, just a natural sweetener of the honey. Okay, so let's get smoothing. So we've got our blender. So first of all, we're going to do is do our bananas. We want to peel our banana. So this one I'm using 3 bananas. And again, as we're blending it, we don't need to chop it up nicely. Also, with the banana as well, it will make the smoothie nice and thick, which is what we want. Okay, so then we've got the banana. What I've got here is I've actually got some ice. So because basically I want to chill it down as well. So to about 10 blocks of ice cubes can go in. We have our natural yogurt. It's about 200 mils of natural yogurt, which can go in. As mentioned, I've got the honey here, so 25 mils of honey going in. Okay, then also what we've got a lady's favourite for their skin. So we're going to cut this open. We're going to take the seeds and drop the seeds inside. Then half of the seeds on this one. Okay, so we put the lid on. And let's get blending. We've blended our lovely mixture. Passion fruit seeds, please, on top. Mint leaf. Straw. And there we go. One tropical smoothie. Enjoy, give it a go. Again, this is full of banana, full of passion fruit. It will give you fantastic filling up for the day.
Right, you're welcome back, and I'm sure you like to try that smoothie at home. It's very simple and packed with a lot of nutrients, so do well to try it at home. But Doc, before I let you go, recently I saw on Instagram that eating eggs feed cancer, blah, blah, blah. I don't know, but now that you are here, is there a specific diet for cancer patients in general, not only breast cancer? And if there is there a specific diet for breast cancer patients?
Okay, so to first talk about some food risk factors for breast cancer. Okay. So especially fatty foods and red meat that has a lot of fat in it, like beefy, fatty foods. Those can increase the risk of you getting breast cancer. Yes, so that is one. Protective meals that you can take is what we call they contain what we call phytoestrogens. So legumes, nuts, vegetables, most vegetables are protective against breast cancer. For the egg parts, I think probably that might be a myth. Okay. Because the eggs, they are also packed with a lot of nutrition in that. Okay. The whole idea is that you should have a balanced diet, a healthy diet, and avoid being obese. Because obesity on its own is a risk factor for breast cancer. So for patients who are also on treatment for breast cancer, the dietitian and the nutritionist take their time to give them tailored meals to help them to be able to gain the weight that they are losing, and also to ensure that they have a balanced diet. They are not taking meals that can increase the risk of breast cancer and all of that.
Right, right. We are slowly coming to the end of the show. But your final words.
Okay, so early diagnosis is still the cornerstone for breast cancer control, and it's something that we keep on advocating. And we can't do it alone. As I said, we will come a month or two and have an enhanced awareness. However, it's left with our community leaders, our religious leaders, our families. They will continue this advocacy for us when we are not sitting on TV. So it is a societal disease, it's a public health, a global public health problem, and all hands on deck.
Right, right.
Yes.
Your outfit, Ridge Medical Center, are you having free screening or anything this month?
Yes, so for this month of October and even going into November, we are having free breast screening, and also we are doing ultrasound scanning, 40% discount for this month of October. And we have two setups actually. So when you come to our facility, we are the SU Tower, close to the Accra Psychiatric, opposite Adabraka Polyclinic, the SU Tower. On our 4th floor, the terrace, we actually have another setup in which there's a nurse there from morning to afternoon who will be doing the screening. And for anyone who comes to the top part, we're actually giving snacks for the first 30 women.
I will be there.
Yes. The first 30 women who come to, if you come to our facility, we'll do it. But if you come to the upper floor terrace, we are doing it in partnership with our Aries property.
Okay.
So we hope to see you there. And if maybe you need directions there, I can give them our phone number.
Okay.
So you can call us on 030-2235-269.
Right.
Yes, or you can also call 059-161-3081.
Right, right. There's free screening. There's free food. Why will you not be there? I don't know why you will not be there. What will hurt if you get screened and you get free food? So I'll be expecting you to get screened. It's the month of October. Take advantage of all the goodies that comes with the month of October when it comes to breast cancer. Get screened, get tested, know your status. If there is cancer in your breast, it's not a death sentence. Early detection, early treatment will prevent you from losing your breast and ultimately your life. My name is Ethel Poplampo. The show is Living Well. Thank you for joining. See you again next week.